Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then the drug is desmopressin. Desmopressin is actually a synthetic analog. This desmopressin is a synthetic analog of vasopressin, and this desmopressin is a 9 amino acid peptide, or it is also called as nanopeptide. So the main pharmacokinetics of desmopressin are: this desmopressin is poor oral absorption. It causes poor oral absorption. It can be given intranasally, and recently there is oral formulation has been started, which is actually a syrup has been approved by the FDA. And mechanism of action is this: desmopressin acts more commonly on V2 receptors than V1 receptors. So desmopressin acts on V2 receptors. When it acts on V2 receptors, it causes more increased absorption of water occurs in the V2 receptors. Whereas when desmopressin acts on V1 receptors, it causes vasoconstriction through the constriction of smooth muscles through GQ pathway or IP3-DAG pathway. This V2 receptor absorption of water is mainly present in the collecting duct of renal tubule. Okay, so this V2 receptor is actually a GS type of protein. It is a GS type of G protein coupled receptor, whereas V1 type is GQ type of G protein coupled receptor, which acts via IP3 and DAG pathway. Then, what are the uses of the desmopressin? Desmopressin is used in nocturnal enuresis. We can use this desmopressin. It is actually the drug of choice for nocturnal enuresis. We can use either the oral formulations or intranasal formulation can be used for this nocturnal enuresis. Then desmopressin is also the drug of choice for hemophilia A. Desmopressin is also the drug of choice for cranial or craniogenic diabetes insipidus. It can also be used in other diseases, like we can use it in Christmas disease, or it can be used in von Willebrand disease. We can use vasopressin, desmopressin, because mainly by extrarenal V2 receptors it regulates the release of factor 8 and von Willebrand factor. Because it regulates or increases the release of factor 8 and von Willebrand factor, we can use desmopressin in Christmas disease and von Willebrand disease. They are also effective in some cases of esophageal variceal bleeding also we can use, because they cause vasoconstriction by V1 receptors, and they can also be used in colonic diverticular bleeding also. Then they cause renal concentration test is seen in the vasopressin or desmopressin. Then side effects. Side effects of desmopressin are: desmopressin will result in hypertension. It can cause hypertension as a side effect.
thank you and thank you for watching.